with the community to further the mission and make sure that we're taking care of the folks that are our friends, families, and neighbors. So I'm excited to give you an update today on our COVID response and how we're managing patients and visitors in the facility. So as of March 15th, we've administered or redistributed over 22,000 doses of COVID-19 vaccine. One of those was at a large-scale pod event at the Speedway. And I know Heather and Kelly are going to be on the call and can give you a lot of details about the event, but I was thrilled to be able to participate as a vaccinator at that event, and it was phenomenal. Very smooth operations and very touched by the response from the community, not only in eagerness to be vaccinated, but also in the gratitude that they expressed as they came through those lines. I know that there's been some press about our updated visitor guidelines. The one thing that I really would like to stress is that we've expanded the limited visitation policy for additional visitors for our pediatric and laboring patients. For our pediatric patients, we're now allowing 2 well visitors per pediatric patient. And for our laboring patients, we will also allow 2 well visitors while the mom is laboring. After delivery, we're asking that 1 well support person be able to remain, but the additional support person could come back during our normal visitation hours. So really happy to be able to offer that. We recognize that for those particular patient populations, that additional support for both the patient and the family is very important, and so we've expanded that. Other updates remain in effect as far as the visiting hours and how we manage that 1 visitor during those times. We're currently treating 20 patients who have tested positive across the market, 6 patients on the Martinsville campus and 14 on the Danville campus. And really just want to close with some reassurance to the community that it's certainly safe to come to the hospital, not only as a patient, but if you have a loved one here, we encourage you to come and participate in their care. We don't want anyone to wait to receive treatment. It's been an unfortunate side effect of the pandemic where we've seen folks that have delayed their care, sometimes with detrimental effect. So we are open for business. We are a safe place to come for you to receive care or to participate in the care of your loved one. And we're excited to have the community come back and allow us to help them be healthy.
Thank you, Barbara. Haley, Kelly, do either of you have anything that you would like to add for SOVA?
Say, I don't have anything.
Okay, thank you. Nancy?
I don't think Kelly has anything additional either. We're having some technical glitches.
All right, if we need to come back to you guys, I'm happy to do that. Nancy, would you like to give us an update from the Virginia Department of Health?
There's a lot going on, and that's good. So I have a whole page here I'd like to refer to during my report this time. First of all, you've heard, I think, in the news about Virginia Department of Emergency Management and VDH working together to open up community vaccination centers in Virginia. And we're pleased to report that Danville is one of 4 in the state of Virginia, and it opened up March 15. What's exciting about that is they can do 3,000 vaccinations a day. So they are pulling from Central Virginia, West Piedmont, and Southside health districts for people who don't mind or are able to take a little trip in the car. They can get their vaccine almost immediately. These clinics do not replace the smaller clinics that we're having or the large ones we have like at the Speedway. This is just another layer, another way to get people vaccinated as quickly as possible. To date, they are using almost exclusively Moderna with a bit of Pfizer. Both of those require 2 shots. So be cognizant when you get a call about getting your vaccine in Danville that you're willing to go back to Danville to get the second shot. You must go back to where you got your first shot. That's how a supply keeps, the supply chain will send your dose to Danville. So we encourage people to do that. Another exciting thing is that, you know, we've had this registration for people in 1A and 1B, and that's now open for everyone to, if you have held back because you weren't 1A or 1B, you can go ahead and register on there. The quickest and best way to get your vaccine is to register on vaccinatevirginia.gov, because that's where we pull. If SOVA says we are going to vaccinate 3,000 people at the Speedway, we pull 3,000 people from that list. So the list is the key to getting your shot, and the key to getting on the list is to go to vaccinatevirginia.gov. We are preparing to move out of 1B, but not yet. We still have some essential workers, and we're still digging for populations that we may have missed. There are a lot of shut-ins and older people who haven't answered their phones because of all the phone scams. So we are encouraging the public to please pick up your phone if you can. We're working on a scenario for getting homebound people vaccinated. We've heard from Meals on Wheels volunteers. So now comes the hard work for us as we try to scour and make sure we have all the elderly people and people with chronic health conditions taken care of before we start with the general public. But fortunately, we have a number of wonderful partners who are helping us do that. I'll give you some numbers. We haven't talked numbers in a while. I'd like to say this is our closing out numbers of cases is that we've had since the pandemic began, 5,814. As you know, that number of new cases is shrinking weekly. Too soon to let our guard down, but the trends are looking awesome. Unfortunately, we have lost nearly 200 people in Martinsville, Henry County to the pandemic, and we need to keep them front of mind. In terms of vaccinations, Henry County now has a total population of 15,046 who have received at least one dose of the vaccine, and 4,325 are fully vaccinated. In Martinsville, 4,006 people have had at least one dose of the vaccine, and 1,156 are fully vaccinated. The numbers are looking great. We're getting lots of calls complimenting SOVA for how they, and our public works partners on how smoothly the Max Vax events have been. People were courteous. They took away the fear. They were friendly. The injection didn't hurt. All kinds of positive. And I was there last Friday, and I observed that the people doing the vaccinating and the volunteers and even the people directing traffic were smiling and welcoming. And I think that's the key to getting everyone through. So we're so grateful to our partners for taking that on. None of this would be possible without them.
Thank you so much for your report, Nancy. We'll go to John Turner, who's with the City of Martinsville. John, what would you like to add for the update today?
So looks like we are moving forward with the weekly event at the Armory. However, we did cancel today's event due to the weather forecast. We are working on a contingency plan for that in the future if we do have another severe event. Other than that, you may want to talk with Heather about anything planned for the future other than those events.
Hey, yeah, we are very excited to get that up and going. I hate the weather didn't cooperate today, but I think that will be a great venue. We're going to work on getting those numbers ramped up a little bit the next week we do it. And that's localized here. It's easy to access. We'll still be going through the VDH list as well for those recipients of those. But I think that will be a great place and a consistent place, and especially when we can get a contingency plan for the weather.
always appreciate the collaboration with all of our partners on this. So it's always a work in progress because we're always looking for places to tweak. So thank you, John, for looking into that.
Thank you, Haley, and thank you, John. Matt Tatum with Henry County.
Good morning, and thank you for the opportunity. And I'm hopefully seeing some light at the end of the tunnel. We're hearing some things such as some of our commercial partners that are doing vaccines are actually having vacancies within their vaccine opportunities. And I know that there's still a lot of people to be vaccinated, but I'm hoping that that's given us some sort of an indication that we are getting close to the end with the opportunities remaining vacant, and so continuing to work with SOVA to do additional opportunities in the community, working specifically with trying to develop a plan on how to target some of the health equality issues and those who are less fortunate or low income populations, and as Nancy mentioned earlier, working with some of the food banks and so forth to identify how we can target specifically those individuals. Also, John pointed out an excellent opportunity here with weather-related events. Our large pod, or the site that we use at Martinsville Speedway, obviously is a drive-through, and so I'm starting to try to come up with a contingency plan for that site location should we have last-minute weather come in. I don't anticipate anything for this week, but in the future. So we just continue to vaccinate. I do think Friday's event was very successful. I've heard a lot of comments as well that people were pleased with that event, and we're continuing to work forward and continuing trying to get shots in arms.
Thank you, Matt. And John, just I would like to just clarify when you were referring to the site today being postponed because of the weather, that is for Thursday, March the 18th.
Correct. That was a first dose clinic that we were going to hold, so we may just shift everything back 1 week.
Okay, thank you. Okay, does anyone else have anything that they need to add before we go to the media? Okay, if not, Bill, would you like to start us off with questions from our media partners?
Am I unmuted?
Now you are, sir.
I'm sorry. I'm going to pass again. You guys are doing a great job. Appreciate the good information, and this is looks good. Thank you.
Thank you, Bill. Luis?
Good morning, everyone. Can you all hear me before I start? Thank you. Again, thank you for allowing us to participate and for hosting this. We're sharing a lot of good news, so it looks like all of the good news is shared rather quickly, which is a good thing. First question for Nancy. The public has always asked us about why you all